Hello everyone. In this video, I will be sharing another drug update and medication insights for WEGOVY semaglutide. WEGOVY is a long-acting, once-weekly injectable peptide medication, which is currently indicated for chronic weight management, risk reduction for major adverse cardiovascular events, and the treatment for noncirrhotic metabolic dysfunction-associated steatohepatitis. Now, let's dive into this medication in more detail. Semaglutide, brand name WEGOVY. This medication was initially approved by the US FDA in December 2017 for the treatment for type 2 diabetes under brand name Ozempic. The brand name WEGOVY product is currently indicated in combination with a reduced calorie diet and increased physical activity to reduce excess body weight and maintain weight reduction long-term in adults and pediatric patients aged 12 years and older with obesity, BMI greater than or equal to 30 kg per square meter, or adults with overweight, BMI greater than or equal to 27 kg per square meter. In the presence of at least one weight-related comorbid condition, the chronic weight management indication for adults was approved in June 2021. Further, in March 2024, WEGOVY was approved to reduce the risk of major adverse cardiovascular events, CV death, non-fatal myocardial infarction, or non-fatal stroke in adults with established cardiovascular disease and either obesity or overweight. Most recently, in August 2025, WEGOVY received an accelerated approval in the US for the treatment for non-cirrhotic metabolic dysfunction-associated steatohepatitis, MASH, formerly known as non-alcoholic steatohepatitis, NASH, with moderate to advanced liver fibrosis, consistent with stages F2 to F3 fibrosis in adults. Chemically, WEGOVY is a synthetic 31 amino acid, glucagon-like peptide 1, GLP-1 analog. Semaglutide has a molecular weight of 4,113.58 Dalton and 94% sequence homology compared to human native GLP-1 hormone. This medication is a peptide analog and ends with tide, T-I-D-E, within the drug name. Notably, the lipophilic C18 fatty diacid moiety attached to the peptide analog makes the drug molecule more lipophilic, enabling high protein binding and prolonged half-life. This medication is available as 0.25 mg, 0.5 mg, 1 mg, 1.7 mg, or 2.4 mg in a single-dose pre-filled pen for subcutaneous injection. Recommended dosage: initial 0.25 mg subcutaneous injection once weekly for 4 weeks, with or without meals. Then follow the dosage escalation schedule, titrating every 4 weeks to achieve the maintenance dosage. For maintenance, MASH indication 2.4 mg once weekly, if not tolerated, 1.7 mg once weekly. For other indications, either 2.4 mg recommended or 1.7 mg once weekly. Given this is a peptide product, WEGOVY needs to be stored in a refrigerator at 36 to 46 Fahrenheit, which is 2 to 8 Celsius. Do not freeze, do not expose to direct sunlight. If needed, Prior to cap removal, the pain can be kept from 8 to 30 Celsius, 46 to 86 Fahrenheit, up to 28 days. This medication carries a US box warning, risk of thyroid C-cell tumors. This was based on in vivo rodent animal model studies. The risk to cause thyroid C-cell tumors in humans is unknown at this point. Mechanistically, this medication works as a selective GLP-1 receptor agonist, suppresses appetite, lowers food intake, delays gastric emptying, and leads to weight loss. Further, the exact mechanisms of cardiovascular risk reduction and for treatment for MASH in humans haven't been established, though may involve pathways mediated by weight loss and other confounding factors. Pharmacokinetically, Tmax, that's the time to reach the maximum plasma concentration, 1 to 3 days. The absolute bioavailability, 89%. Volume of distribution is about 12.5 liters following subcutaneous injection in patients with obesity or overweight. Protein binding, greater than 99%. Metabolism. Semaglutide is mainly metabolized via proteolytic cleavage of the peptide backbone, along with the sequential beta oxidation of the fatty acid side chain. Half-life is approximately 7 days, 1 week. Given its long half-life, therefore this medication is administered once weekly. Excretion in the urine and feces, about 3% of the dose in the urine as a parent drug molecule. Drug-drug interactions. WEGOVY delays gastric emptying and may impact absorption of concomitantly taking oral drugs. Just be very mindful. Contraindications. Personal or family history of medullary thyroid carcinoma, MTC, or in patients with multiple endocrine neoplasia syndrome type 2, MAN2. Known hypersensitivity to semaglutide or any of the excipients in WEGOVY. Adverse reactions greater than or equal to 5%, nausea, diarrhea, vomiting, constipation, abdominal pain, headache, fatigue, dyspepsia, dizziness, abdominal distension, eructation, hypoglycemia in patients with type 2 diabetes, flatulence, gastroenteritis, gastroesophageal reflux disease, and nasopharyngitis. Here is the key reference which I have used to prepare for today's video. Most of the medication information which I shared today is based on the WEGOVY prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website as well. Finally, I want to thank you all so much for watching. If you found this video helpful, consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.